Attention please, the event will start soon. Please to all the participants to turn off the microphone and turn on the camera. Before begin, let me read the rules for today's guest lecture. First, during the event, participants are requested to turn off the microphone. Second, at the end of the presentation, there will be a question and answer session. Participants who want to ask questions are welcome to write them down in the Zoom chat. Third, please write the question with the format name, underscore class, underscore the question. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. The Honorable of the guest lecturer today, Madam Michelle A. Calda-Tolibas, Ph.D., MEN, RN, the Dean from College of Nursing, Visaya State University. The Honorable to Mr. Dr. Muhammad Wildan, Apperpen MPD, as the Director of Poltekkes Malang. The Honorable to Madam Endang Purwaningsih, Askep Nurse MKab, as the Head of Study Program, the Third Diploma of Nursing, Ponorogo. All the sub-coordinators of the Third Diploma of Nursing, Ponorogo. The Honorable of the all lecturers and academic communities of the Third Diploma of Nursing, Ponorogo. And to all dear students. Firstly, I would like to say the utmost gratitude towards God for letting us together in today's event guest lecture on the third with the topic, the assessments for risk factors of type 2 diabetes mellitus in health people and the role of nurse in overcoming it with a good and stable state of health. I also would like to say thank you for the participants, especially Madam Michelle A. Calda-Tolibas, Ph.D., MEN, RN, for the willingness to join with us on this Zoom meeting in the event and guest lecture. I'm Dika Galwidianingrum, will be the master of ceremony for today's event guest lecture with Madam Michelle. Well, I will read out the rundown of today's event, which is divided into 6 parts. First, opening. Second, singing the national anthem Indonesia Raya and Poltekkes Malang. Third, welcome speech from the head of study program, Madam Endang Purwaningsih, Askep Nurse MKab. Fourth, pray. Fifth, presentation and discussion. And the last is closing. Well, next is singing the national anthem Indonesia Raya and Poltekkes Malang. To the step on Jadi, the time is yours. All right, thank you. The next is welcome speech from Madam Endang Purwaningsih as Nurse M.Kab as the head of study program, the third Diploma of Nursing, Ponorogo. Hello, Ibu Endang.
Halo, Mbak Rika. Suara saya bisa didengar?
Bisa, Ibu. Sudah siap nggak, Ibu?
Oke, insya Allah siap.
Well, to Madam Endang, the time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning. The Honorable Madam Michelle Calda-Tolibas, Ph.D, Dean of College of Nursing, Visaya State University. Good morning.
Good morning.
Ladies and gentlemen, academic community of the Diploma Degree of Nursing Program, Poltekkes Kemenkes Malang, and all of students that I am from. Alhamdulillahirabbil alamin, kita panjatkan kehadirat Allah Subhanahu wa taala. Hari ini kita bisa berada dalam Zoom meeting dalam rangka kuliah pakar Prodi D3 Keperawatan Ponorogo. We are the Diploma Degree of Nursing Program, Poltekkes Kemenkes Malang, can hold an expert lecture with the theme, the assessment for risk factor of type 2 diabetes mellitus in healthy people and the role of nursing in overcoming it. Thank you so much, Madam Michael. We are willing become the guest lecturer or an expert lecturer for us with the subject. 1. The latest diabetic theory and the assessment for risk factor of diabetes mellitus in health problem. 3. The roles of nursing in confirming for risk factor of diabetes mellitus. Kegiatan ini adalah kegiatan rutin yang dilakukan oleh Prodi D3 Keperawatan Ponorogo dalam rangka untuk mencapai visi misi, yaitu tentang upaya preventif dan promotif keperawatan diabetes mellitus. This event and effort to realization of our mission is needed to be civility and globally competitive with preventive and promotive nursing care for diabetes mellitus. And for all, if co-student, please and careful enjoy. Dan kepada seluruh mahasiswa serta audien yang berada pada room Zoom ini, mohon untuk partisipasinya aktif menyimak. Ini adalah pengalaman pertama kita mendatangkan narasumber dari luar negeri. Thank you so much and the best regret. Sekian dari saya, selamat belajar. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you to Madam Endang for her welcome. Terima kasih kepada Ibu Endang atas sambutan yang diberikan. And the next is pray that will be led by Bima Akbar. Hello, Bima.
Yes, hello.
Well, so Bima Akbar, the time is yours.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Before we start our event today, let us for a moment together bow our heads, pray to God so that our activities today are blessed and can run smoothly. And allow me to lead the Islamic prayer using Indonesian. To all ladies and gentlemen, please be pleased to adjust according to your respective beliefs. Bismillahirrahmanirrahim. Allahumma salli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad walhamdulillahi rabbil alamin. Hamdan syakirin, hamdan na'imin, hamdan yuafi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu, kama yanbaghi li jalali wajhikal karim wa azimi sultanik. Ya Allah, Ya Rahman, Ya Rahim. Ya Allah yang Maha Pengasih lagi Maha Penyayang. Pada hari ini, Jumat 3 Maret 2023, Kami di sini hendak menyelenggarakan acara guest lecture dengan memohon ridho dan izin-Mu. Berkahilah semua langkah dan perbuatan kami, dan jadikanlah acara ini sebagai nilai ibadah dan nilai ilmu yang bermanfaat bagi kami semua. Ya Allah, ya Ghafur, Engkau yang Maha Pengampun atas segala dosa. Ampunilah semua dosa kami, dosa orang tua kami, dosa para pemimpin kami, dosa para pejuang-Mu, dan dosa para pendahulu kami. Tempatkanlah kami dan mereka semua dalam lindungan, rahmat, dan ampunan-Mu. Allahumma adfa'ana al-bala wal waba wal fahsya wal munkar wa mihan ma dhahara minha wa ma batan fi baladina hada khasa wa fi buldanil muslimin 'amma bi rahmatika ya arhamar rahimin. Allahumma inna na'udzubika min adzabil jahannam wa min adzabil qabri wa min fitnatil mahya wal mamat wa min syarri fitnatil masihid dajjal. Allahumma arinal haqqa haqqa warzuqna ittiba'ah wa arinal batila batila warzuqna ijtinabah. La ilaha illa anta subhanak inna kunna minadh zalimin. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wa subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Al-Fatihah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. All right, thank you to Bima Akbar. To all dear participants, then we will start the main event, which is the presentation by Madam Michelle A. Calda-Tolibas, Ph.D., MEN, RN, RM, the topic, the assessment for risk factors of type 2 diabetes mellitus in health people and the role of nurse in overcoming it. The discussion will be guided by moderator Nataya Rizka. Before that, to all dear participants, please fill out the attendance form immediately. Dimohon kepada seluruh partisipan untuk mengisi absensi yang akan di-share. Terima kasih. Well, now, I will read out Nataya's curriculum vitae. Name, Nataya Rizka Octavia, place and date of birth, Ponorogo, the 7th of October 2002. Now, she is studying for her third diploma of nursing in Ponorogo. All right, I will say hello to Nataya first. Hello, Nataya.
Hello, Rika.
Okay, are you ready to guide the discussion today?
Of course.
Okay, Nataya, now the time is yours.
Okay, thanks to the MC for the opportunity then. All right, ladies and gentlemen of the guest lecture participants, let's go straight to the main event that we are most waiting for, namely the delivery of material as well as a discussion which will also have a question and answer session after the two materials can feed the material. However, before that, I would like to greet my beloved lecturers and my participants first. The Honorable Madam Michelle Calda-Tolibas, Ph.D. MAN RN as the presenter. The Honorable the Director of the Malang Ministry of Health Polytechnic, Mr. Mohwildan A. Perpen MPD. The Honorable Head of the Ponorogo Nursing Third Diploma Study Program, Madam Endang Purwaningsih SKAP Nurse MKAP. Lecturers as well as the attendees of the internal guest lecture participant who I care about. Good morning, ladies and gentlemen. How are you today?
Fine.
Okay,
Fine.
ladies and gentlemen, said the guest lecture on the day took the theme of the assessment for risk factors of type 2 diabetes mellitus in health people and the role of nurses in overcoming. For that, of course, we really need information as well as an evert the equalized perception as we hope together in this internal guest lecture. Before presenting the material, make a little introduction regarding the material that will be delivered by the presenter. Basically, scientific forums like this are very important and interesting for us to follow because we will get a lot of information. However, it should be noted that the delivery of this information will be easier understood if the discussion runs effectively. Therefore, it is hoped that all attendees can pay attention and follow the discussion as well as possible. Right, then I will convey some of the provisions of our core program as follow. We give 45 minutes to deliver the material for speaker. While the presenter is delivering the material, participants are not allowed to interrupt. The question and answer session will be opened after the speaker conveys all the material. Saya ulangi untuk peraturan Zoom meeting kuliah tamu kali ini. Saat pemateri sedang menyampaikan materi, partisipan dilarang untuk melakukan interupsi dan sesi diskusi akan dibuka ketika pemateri sudah menyampaikan materinya. Those are the rules we will use. For the first turn will be given by the presenter. The speaker is a unique speaker. I want to read her curriculum vitae. It is her curriculum vitae. Okay. Her employment history until now, she served as Associate Professor 3 at Visaya State University College of Nursing. Her educational history, she studied diploma at Kagamutan Elementary School, then HS diploma at Gala Vocational School, and then she studied at the Colegio de San Lorenzo Ruiz de Manila, INC, and successfully holds a Bachelor of Science in Nursing. Then she continued her education at the University of Eastern Philippines and earned a Master of Arts in Nursing or MAN degree, then at Cebu Normal University and earned a Doctor of Science in Nursing or DSCN Kent, and finally at St. Paul University, Philippines and earned a Doctor of Philosophy in Nursing Science degree. Examination taken and passed. Midwifery licensure examination, Philippine Nurse Licensure Examination, CGFNS Examination, Test of English as a Foreign Language, and Test of Written English. Personal detail, profession nurse midwife, PRC license nose, RN 0326477 RM 0147033, occupation Associate Professor 1, date of birth on 2nd April 1977, place of birth Sagamutan Gamay, Northern Samar, Philippines, and special skills IV therapy nurse preceptor, IV therapist, and teaching. Okay. Before we go, I wanted to say sorry to Madam Michelle if my English pronunciation is not good enough. Hopefully you can understand what I say next. Next, we invite the presenters, the Honorable Madam Michelle A. Calda-Tolibas, Ph.D. MAN RN to deliver the material. For Madam Michelle, time is yours.
Hello, good morning.
Morning,
Morning,
ma'am.
Madam.
Good morning. So
Fine,
am I going to share my slides, or is it user Agus who will be sharing my slides?
Okay.
Wait a minute, madam.
So it's you who will share the slides, the one that I have sent to you a while ago.
Okay, let's.
Oh yeah, thank you. Okay, so when I was invited to talk about this topic on diabetes mellitus, and I was given the task in subtopic. So I was given a task to discuss first the latest diabetes mellitus or the theory on this one. Okay, next slide, please. So our objective for these topics are at the end of the discussion, the participants will be able to describe the theories related to type 2 diabetes mellitus. And the second one is you will be able to discuss the relationship between the theories and the diabetes mellitus. Okay. So when we say diabetes mellitus, it is understood that it is a chronic disease. It is very common and it is heterogeneous, meaning to say there are a lot of complications from this. Okay. And it is characterized by high levels of sugar in the blood, or the so-called hyperglycemia. So there is a range for this one because of inadequate production or action of insulin. So when we talk about insulin, it is the hormones that regulates blood sugar level. So when we say when we eat something, we know like rich in carbohydrates, it will be converted into sugar. So that's the reason why that there's supposed to be regulator of the sugar in our body, and that is the action of the insulin. Next slide, please. Okay. So as I have said, it is one of the diseases that is chronic and it has a lot of complications. So some of those complications are stroke this is actually due to the thick being sticky blood because of the sugar in the blood. So it can cause blockage, and in the long run, it will damage the blood vessels. So it will result to stroke. And another one, of course, heart attack. It's because also of the very thick blood in the body. Another one is it can result to end stage kidney disease. So it has an effect to the kidney. And of course, it has also an effect to the vision or eyes of the person. And that it is termed actually as the diabetic retinopathy. As you can notice, after a while, after how many years of being diagnosed with diabetes mellitus, you will have difficulty in seeing something. So it has an effect already into the visual acuity. Okay, next slide, please. Okay. So let's talk about the disease process. How the diabetes mellitus occurs. Okay. So the pathophysiology of by the way, we have been discussing about the management on this one. And when it comes to the management, we will be able to manage well the responses of the person from the diseases. So as we were talking about with Sir Agus, we discussed about, we agreed on the discussion of the type 2 diabetes mellitus. Okay. So the pathophysiology, the pathophysiology of type 2 diabetes mellitus is characterized by first, peripheral insulin resistance. So meaning to say, despite there is no problem with the production in insulin, not just like in diabetes mellitus type 1, which is the problem of the diabetes mellitus type 1 is actually there is a problem in the insulin production. But here, there is no such thing as damage to the organ that produces insulin, but the body has resistance. The peripheral circulation has resistance to the insulin. Okay, so next is there is an impaired of hepatic glucose production and declining B cell function. So as the person grows older, we have a lot of theories that there is in one time in a lifetime, as we grow older, we sometimes some of our body parts or organs are damaged and declined in its function. So as a reason, it could not produce, it could not function as the normal one when we are younger. So in here, there is an impaired regulation of hepatic glucose production, and sometimes there is a decline in B cell function and eventually leading to failure of the B cell in terms of its function. Okay? So the primary event that are believed to be an initial deficit in insulin secretion, and in many patients, relative insulin deficiency in association with, as I have said, the peripheral insulin resistance. So the problem here is not really the lack of production, but there is peripheral resistance of insulin of our body. Okay, next slide, please. Okay, so what are the things that are not functioning well in our body? First is the B cell. So there is a dysfunction of the B cell, and it is initially characterized by an impaired, in the first phase of insulin secretions during glucose stimulation, and may antedate the onset of glucose intolerance in the type 2 diabetes mellitus. Okay, this could happen especially when you grow older. Okay, next slide. Okay, so the initiation of the insulin response depends upon the transmembranous transport of glucose and coupling of glucose to the glucose sensor. The glucose or the glucose sensor complex then induces an increase in glucokinase by stabilizing the protein and impairing its degradation. The induction of glucokinase serves as the first step in linking intermediary metabolism with the insulin secretory apparatus. So that is what happens. Next slide, please. So the glucose transport in B cells of type 2 diabetes patients appears to be greatly reduced. So when there is the reduction of the transport of glucose, it will shift the control point for insulin secretion from glucokinase to the glucose transport system. So that is one of the causes of hyperglycemia. Next. So later in the course, the second phase release of newly synthesized insulin is impaired as of now, and if an effect that can be reversed in part of at least in some patients by restoring strict control of glycemia. The secondary phenomenon termed desensitization of B cell glucotoxicity is the result of paradoxical inhibitory effect of glucose upon insulin release and may be attributed to the accumulation of glycogen within the B cell. So, as I have said, it will result to high blood sugar in the body. Next. Another theory in the disease process of type 2 diabetes mellitus is actually autoimmune destruction of the pancreatic B cells. So there are some instances that we react to our own body, and that is the so-called autoimmune. Okay, so there is once there is an antibodies in our body will react. However, in some instances, this autoimmune, the one that fights against infection, against foreign body, are destructive enough to distract also some of our autoimmune system. Meaning to say, they have this kind of characteristics that can disrupt our own autoimmune, the one that fights the foreign body. Okay, so it could happen, and that in the diabetes mellitus, it could distract the pancreatic B cells, and may be the factor of a small subset of type 2 diabetic patients, and has been termed the syndrome of latent autoimmune diabetes in adults. Next. Another problem that we can experience, as I have said in the early discussion, is the insulin resistance. So this emanating from the prismatic demonstration of Yellow and Person of the presence of hyperinsulinism in type 2 diabetes. So insulin resistance has been considered to play an integral role in the pathogenesis of the disease. So that is actually the so-called peripheral resistance to insulin. Next. Okay, another problem that can cause in the disease process of type 2 diabetes mellitus is liver problem. So the ability of insulin to suppress hepatic glucose production, both in fasting state and postprandially, is normal in first-degree relatives of type 2 diabetic patients. Okay, next is, okay. Now, I was asked to discuss about the theories of diabetes mellitus. Since I have been teaching about the gerontology in nursing, and some of the theories of aging are can be discussed how it affects, as I have said in my early discussion, that as we grow older, there are some problems that can contribute to the dysfunction of our organs. So we have a lot of theories in aging that can be related also to the development of type 2 diabetes mellitus. So we have a lot of theories like biological, psychological theories, and spiritual in aging. But in relation to diabetes mellitus, we have the so-called biological. So biologic theories in aging, it concerns with answering the question regarding physiologic process that occur in all living things over time. As I have said, as we grow older, there are so many theories that could limit our growth, that could slow down the function of the body. So there are a lot of biological theories. Okay, so biological theories explains the physiologic processes that change as we grow older. Okay, so in biological, we have these theories that could address the anatomic and physiologic changes that occurs as we grow older. Next slide, please. Okay, so the biologic theories of aging is divided into two, the stochastic and non-stochastic. But this time around, since we'll be discussing about the diabetes mellitus, we'll be focusing on the stochastic theory, a stochastic biologic theory. So the stochastic biologic theory It explains aging as events that occur randomly and it accumulates over time. Whereas the non-stochastic biologic theory, it views that aging as certain predetermined time phenomena, meaning to say, we have in non-stochastic biologic theories, we have a limited lifespan. So that's the reason why that sometimes in genetically, we have this so-called, there are some families that they die young, like at the age of 60, they, most of the family members die as early as that. But there are some people who dies later, like their family dies at the age of 90, 80, so they grow older than the others. It can be explained by the non-stochastic biologic theory. Next slide, please. So the one that, okay, next. Okay, so we have the so-called stochastic biologic theories, but the one, there are four: the error theory or the error catastrophe theory, the free radical theory, cross-linkage theory, the wear and tear theory. So these are theories in aging that can, that is under the stochastic biological theory. But the one that can be connected to the development of the diabetes mellitus is actually the error theory and the cross-linkage theory. So those two are the one that can be related to the development of the disease process of the diabetes mellitus type 2. Next slide, please. Okay. So in the error theory or the error catastrophe theory by some other authors of the book, it says that it is based on the idea that errors can occur in the transcription of the synthesis of DNA. These errors are perpetuated and eventually lead to systems that do not function at optimum level. So that is in one of the explanation, in one of the pathophysiology of the disease of type 2 diabetes mellitus is actually due to the reduction, and it could be connected to the error theory. And that's the reason why there is a low level production of the insulin. Okay, next slide, please. Okay, so another theory that can be connected, an aging theory that can be connected to the diabetes mellitus is the cross-linkage theory. How this cross-linkage theory play a vital role in the development of diabetes mellitus. It says that with age, according to this theory, some proteins in the body become cross-linked. So this does not allow for normal metabolic activities. And waste products can be accumulated in the cells, and the end result is that the tissue do not function at optimum efficiency. So they are not functioning well as the way it functioned when we were young. Okay, next. Okay, so this theory proposes that as person ages, as we grow older, and the immune system becomes less efficient, the body's defense mechanism cannot remove the cross-linking before it becomes securely established. Okay, and the accumulation of the cross-linked proteins can damage the cells and the tissues, and it slows down the bodily processes. That's the reason why there is a decline of the function as we grow older because of the cross-linkage theory. Next slide, please. Okay. So the aging process is similar to the tanning leather, where purposely creates cross-link. So with the cross-linkage that is found in saturated fat, what will happen? Like when we are taking medications like the antacid and coagulants in baking powder, the zinc and the magnesium. So it is associated with the radiation exposure. So it can cause the linkages of the protein in the body. But it can be managed naman with the diet, restriction, and some exercises. Okay. Next is in this theory says also that the blood glucose react with bodily protein to form cross-link. So how it reacts? It crystalline of the eye, the membrane of the kidneys. That's the reason why that when there is crystalline of the eye, we can have diabetic retinopathy. And if we have membranes of the kidney, it can affect the cross linkage could happen in the membrane of the kidney, so we can have problems in the kidneys. That is the reason why we have the so-called complications to the kidneys, and it could result to end-stage kidney disease. So blood vessels are susceptible also to cross-linking under the condition of increased blood glucose. Next slide, please. Okay, another theory that can be coined to the development of the diabetes mellitus is the genetic theory. So humans and animals are born with genetic program that predetermine their health. Okay, so there are some people who have that in their blood, who have that in their cells, who have that in their genes. So if the family, if the mother or the father or the grandparents of that person have this diabetes mellitus, there is a possibility for the offspring to have this diabetes mellitus. So it is a hereditary disease. Okay, so that is in genetic theory. Okay, next slide, please. Another one is the nutrient theory. Okay, it says that you are what you eat. Okay, so there are dieters who really coined your health based on the diet. Okay, so it is about the nutrient theory. So there are some diseases that are caused by what you eat over the span of their life. So for example, a good example of this one, if you are eating a lot of fatty foods, eating a lot of unhealthy foods, burger, it can result to some diseases like hypertension, heart problems, atherosclerosis. So in the same way that if you drink a lot of processed food that are with sweeteners, if you eat a lot of ice cream, soft drinks, soda, those juices in cans they are actually prepared with a lot of sugar. So it could result, if you have been eating for like now years, decades, it could result, even if you don't have diabetes mellitus in the family, it could result to a disease like diabetes mellitus. So this theory states that good nutritional intake at any age will help in the improved health as one ages. So what you deposited when you were young, it could be garnered at the end of your life. Like when you grow older, if you have been eating healthy food, you will have a healthy aging process. Next slide, please. I think that's the last. Okay. So it is just timely, maybe if you want to have if you want to ask some questions, or if you have questions that is related to the disease process, and you can ask some questions. So I have included this one because when I discuss something about with Sir Agus, he said that we are trying to make a research on something, and maybe in my mind I was thinking that we are looking at the theoretical framework in order to discuss it well in the research. So I have thinking that maybe you are looking at a good theoretical framework when you propose a research project that is related to diabetes mellitus. So those theories, you can also use that one in your theoretical framework in making your research proposal.
Okay, thank you so much for Madam Michelle for the material. Previously, allow me to ask you first, is the discussion session held after the presentation of the material is finished, or is it
Okay.
carried out every one material is finished?
Not yet. That is just the first part. Maybe you want me to continue to the next?
Oh, okay.
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 To participant, you can write your question in chat room or in a discussion session after all materials are delivered.
Okay.
Okay, next.
Officer,
Okay, next.
kindly share the second material.
Okay, and in the second material entitled The Assessment for Risk Factors of Diabetes Mellitus in Healthy People and the Role of Nurse in Overcoming for Risk Factors of Diabetes Mellitus, it can be concluded. Next, the
Okay.
second material for
Okay,
Madam Michelle,
okay.
time is yours.
Okay, so I will continue with since I have discussed about the description and the pathophysiology of the disease. We will be discussing about on how to assess the individual to learn more if they have this problem. Okay, so next slide, please. Okay, so for this topic, the objective is to identify the risk factors of type 2 diabetes mellitus. Next slide, please. Okay. So, in continuation of the discussion that I had discussed earlier, so these are the factors that can be seen in a patient, or can be assessed in the patient who are suspected to have diabetes mellitus. So these are the risk factors. One is pre-diabetes, meaning to say, when we say pre-diabetes, this is a health condition, but this is serious actually. This is a serious health condition that you have a high level of blood sugar in the body. However, it cannot be diagnosed still to be a type 1 diabetes mellitus. But your blood sugar is consistently high, but it does not belong to the level of blood sugar in the body that can be diagnosed to be a diabetes mellitus. Okay, so these are the risk factors. This is the pre-diabetes risk factors. An overweight person. If you see someone who has a very big, very fat person, maybe you could think that maybe this person is having high blood sugar, and maybe he or she is suffering from pre-diabetes, meaning to say before the diabetes can occur. So an overweight is a manifestation that a person may have diabetes mellitus. Another one is 45 years older or older. So it can be connected to the theory that I have discussed earlier, okay? That the error theory, you can connect this one, the age. As we grow older, sometimes because of some lifestyle that we cannot avoid, we can have these pre-diabetes risk factors. Okay, next, if you have a parent, brother, or sister with type 2 diabetes, okay, so you can have an initial assessment that the patient is having pre-diabetes. Another one is physically active, less than 3 times in a week. It could be. So that would be like if you are not doing some exercises, so you can be a risk factor to have a pre-diabetes. Next is have ever had gestational diabetes in previous years during pregnancy or given birth to a baby who weighed over 9 pounds. Or another one is African and American, or it is the so-called race. If actually diabetes, pre-diabetes are racial in nature as well. So it is more common, diabetes mellitus is very common in an American, Hispanic or Latino, American Indian or Alaska Native person, and some Pacific Islander and Asian American people are higher risk to having diabetes mellitus. Okay. So if we are going to divide for you to have an understanding, on if to have a good picture in when we go to the health education that is related to diabetes mellitus, it is better for us to divide the risk factors into modifiable and non-modifiable risk factors, because it is very important for you to know your approach in dealing with a client. So every time that you have, like, if you want to study on something, if you have a case study on a disease process, and you want to know the best nursing care or nursing intervention that you can have, so you will be able to have an effective nursing intervention, you have to analyze things very well. Which one is modifiable? Which of the risk factors are non-modifiable? So when we say modifiable, these are the things that we can do, we can revert, we can prevent. Whereas the non-modifiable, these are the risk factors that is within that person already. You cannot change, but you can have an intervention. You can choose an intervention to address this concern. Next slide, please. Okay. So the one that I have mentioned earlier, the risk factors of pre-diabetes, let's take a look at the non-modifiable. Meaning to say, you really cannot do on that one, like the age. The age of a person, it will go, it will increase. You cannot modify if she is or he is 45 years old. He is 45 years old. So since the diabetes mellitus is a problem as you grow older, if you are 45 years old, you really cannot say you need to become 11 years old tomorrow. You cannot modify that one. Next, if it is hereditary. If it is in the gene, if you have like a parent, a brother, or a sibling with type 2 diabetes mellitus, it is a hereditary. You cannot modify the genes of the family. You cannot, you really cannot modify the genes of that person because it is in their genes. Next, is the history of gestational diabetes or history of the delivery of 9 pounds baby. So if a woman has a history of gestational diabetes, when we say gestational diabetes, that is actually a diabetes that occurs when there is pregnancy. It is because it has something to do with the production of glucose by the placenta. So if the woman has history of gestational diabetes, she can have another diabetes, gestational diabetes, and she is risk to type 2 diabetes mellitus. If the woman has history of big baby, like 9 pounds or more than 4 kilograms, because the normal is from 2.5 to 3.5 kilograms only. So if you have 9 pounds, that is around 4 plus kilograms, you have to suspect that the woman is having high blood sugar. So that makes the weight of the baby, that makes the baby become so big because of high sugar in the body of the pregnant woman. And as I have said, another non-modifiable is race. If you were born a Latino, you cannot modify, you are really a Latino. So the race is a factor in developing type 2 diabetes mellitus. Next slide, please. So, like African American, these are the race that I have mentioned earlier: Hispanic or Latino, American Indian, or Alaska Native person. Some Pacific Islanders can have type 2 diabetes mellitus also, and the Asian American people, they are higher risk to having type 2 diabetes mellitus. Next slide, please. Okay. So let's go to the modifiable risk factors. Being overweight. So you should know the weight of the person according to the height, the weight of the person according to the age, especially the younger one. So if you think that you are overweight, you are risking yourself. The person is risking himself into developing type 2 diabetes mellitus. Next, over 45 years old. So you are having this kind of problem that is to develop type 2 diabetes mellitus in relation to the theory that I have discussed earlier. Okay. So if you are sedentary, or if you are just active, and that is like very seldom, or even less than 3 times in a week, or maybe you are sitting for a longer period of time, like the job of librarian. So that is a long sitting job. If you don't have an exercise at least more than 3 times in a week, you are having risk to develop type 2 diabetes mellitus. Next, if you have non-alcoholic fatty liver disease, you may also be at risk for type 2 diabetes. So that's the reason why in early discussion, in the theory, in the pathophysiology of diabetes mellitus, if you have liver problem, you can have a type 2 diabetes mellitus, especially if you will become diagnosed to have fatty liver. It could result to type 2 diabetes mellitus. However, these are modifiable risk factors, meaning to say the person, if she's aware about all these things, she can do, or they can do something to overcome, okay, to revert this one. So if you are overweight, if you are over 45, if you are not having exercises, you know that you are risk to have type 2 diabetes mellitus, and that will this this is where the nurses or nursing students will come into the picture in order to overcome the healthy people or the people who are having these risk factors already to in order to help the people in the community. Okay, next slide, please. Okay, another non-modifiable is a gestational, another risk factor in having a type 2 diabetes mellitus is the so-called gestational diabetes. So as I have mentioned earlier, when you say gestational diabetes, that is the diabetes that is being developed only when the woman is pregnant. So that is gestational diabetes. If you are not pregnant, if the woman is not pregnant anymore, the blood sugar can be normalized. It is due to the overproduction of the placenta of a lot of hormones, of a lot of like, we know that the placenta plays a role in the development of the fetus. So it has a lot, it functions really well. So, okay. So in gestational diabetes, there are some modifiable also and non-modifiable risk factors. So what are the non-modifiable risk factors to gestational diabetes? We know that gestational diabetes can be a risk factor to development of type 2 diabetes mellitus. Okay. So if the woman has a history of gestational diabetes mellitus, gestational diabetes in previous pregnancy, she was diagnosed to have high blood sugar, that is the gestational diabetes. So it could result to another history of gestational diabetes, meaning to say in the next pregnancy, she can have another gestational diabetes diagnosis. And another one, if that woman has a family history of gestational diabetes, like another sister, when she got pregnant, she had this gestational diabetes, the woman or the sisters, the female siblings can have gestational diabetes as well. Next, non-modifiable risk factor for gestational diabetes is if that person have given birth to a baby who weigh over 9 pounds. So meaning to say, she may have gestational diabetes and she can have another gestational diabetes in future pregnancy, and it is a risk factor to type 2 diabetes mellitus. And another one, if the woman is more than 25 years old, she can have gestational diabetes. So as we can see, the age cannot be reverted. You cannot say that you can be 16-year-old tomorrow. So these are the risk factors, non-modifiable risk factors that is related to the gestational diabetes. And it could result to type 2 diabetes mellitus. Next slide, please. Okay. So another non-modifiable risk factor of gestational diabetes is if you have a family history of type 2 diabetes mellitus, like your siblings, your mother have a type 2 or your father have a type 2 diabetes mellitus, you can have, when you get pregnant, even if during the time that you are not pregnant, you have a normal blood sugar, you can have a gestational diabetes mellitus. So meaning to say, if it is hereditary, you can have gestational diabetes mellitus. And another one risk factor for gestational diabetes mellitus is actually polycystic ovary syndrome, or the so-called PCOS. Okay. Next is, okay. So another non-modifiable is race. Again, in gestational diabetes mellitus, you can have gestational diabetes mellitus if you are an African American, Hispanic, or Latino, and you had a gestational diabetes during the previous pregnancy. And that is under the non-modifiable risk factors for gestational diabetes. Next. Okay. So what is the modifiable risk factor of the gestational diabetes? Overweight. So in this case, being overweight can be reverted. So it is just a matter of a good nursing intervention. We can revert this one. Next slide. Okay. So maybe we can proceed to the next slide.
Okay, thank you for Madam Michelle for the material.
Yeah.
Okay, next we go to the third material. For the Madam Michelle, time is yours.
Okay. Thank you. Okay. So let's talk now about the roles of the nurse in overcoming for the risk factors of the diabetes mellitus. Okay, next slide. Okay, so the objectives for this is to discuss the role of the nurse in overcoming the risk factors of type 2 diabetes mellitus. So at the end of the discussion, the students or the participants will be able to discuss the role of the nurse in overcoming the risk factors of type 2 diabetes mellitus. Okay, next slide. Okay. So as we already discussed the different risk factors, and as I have said, knowing the modifiable and non-modifiable risk factors is very important in the discussion of the intervention when you are planning for an intervention. Okay, so you will be able to get the correct nursing care plan, the correct nursing intervention, or the so-called, I usually call it the individualized nursing care plan. So if you will be able to know the history of your client, it is very important, like if you are taking care of a person with type 2 diabetes mellitus, you need to know the comprehensive health history. So what are included in the comprehensive health history? Of course, the patient's data. What else? Aside from patient's data, you can have also the history, the family history. The hereditary diseases will come out, and you can also have like medical history, the previous hospitalization. So if you will be able to get the information about previous hospitalizations, like when was what kind of disease or what was the diagnosis when she had her hospitalization in previous years. Surgeries and everything should be asked from the client. And aside from that, the obstetrical history is very important as well. As I have said earlier, you will be able to know if she had delivered 9 pounds, and then with that one, you will be able to have an initial diagnosis that the woman is having pre-diabetes, or the woman is risk to have gestational hypertension, or the woman has a problem that could develop into type 2 diabetes mellitus. So aside from that, you have to know the surgeries, you have to know the obstetrical history, you have to know the functional, it depends on you how you approach in taking the information that can be used in your planning in the care of the patient. So with this, you will be able to know your approach. So knowing these things, gathering information that can be used in the treatment or management of the person is very important. So knowing all those, if you have a comprehensive, very detailed history of the client, you will be able to manage the person very well. So in the management of type 2 or the non-insulin or the type 2 diabetes mellitus, you can have health education. So these are the management of the client. Health education can be done, especially in pre-diabetes. So if the woman is having like overweight, not or having sedentary lifestyle, like she is or he is having exercise only once in a month, you know that he or she is risk to having type 2 type 2 diabetes mellitus. So like what do you think is good in good nursing intervention that can be included when you do your health education to your client? One is blood sugar monitoring. In the Philippines, actually, we can buy, or there are some patients, especially if they can buy the equipment in monitoring the blood sugar, they can do it at their home. So it is a home management. Blood sugar monitoring, I think in the Philippines, it's like they can already buy at 4,000 pesos blood sugar monitoring. But the most expensive is the strip, actually. But at least you will be able to monitor even at home. You don't need to go to the hospital. You don't need to spend for the transportation and for the checkup. You can have it at home. So health education on blood monitoring is a must, especially for those who have pre-diabetes. Next is, of course, as part of your health education, is the dietary modification. If she had been or he had been eating a lot of carbohydrates like burgers, pizza, ice cream, cake, they are so delicious, so yummy, but that is the effect. So you can do health education in order to prevent this type of disease to occur. So dietary modification is a good part of your health education. Next slide, please. Okay. Next slide. So for the persons or the people who are problem with the weight and they are having overweight, and that is very common actually. Even this time, it is very common to have an overweight people. So again, you can do health education. You can teach them on how to modify their diet. If they are eating a lot of carbohydrates, rice, and burgers, and everything, if they are eating in the fast food, actually, food in the fast food is not healthy. You would rather prefer vegetables than to buy, and they are not expensive. So for the overweight, as I have said, it should be, you can do health education, and as part of your health education is dietary modification. So let them, ask them to eat more green or colorful, green, like vegetables, and a little of fruit. Because there are some tropical fruits that are so high in glucose. So that is not also allowed. So although we are advised to eat fruits and vegetables, but you have to have limitation in taking fruits. And you have to Google actually if you really want to know the glucose content of the fruits, you can Google it. It can be Googled the content by grams. Okay, so there are a lot of especially tropical fruits. They are so sweet, like the mango. Okay, mango, and other fruits. Okay, so you would rather take one whole apple than to have one whole mango. So it has a lot of glucose. So as I have said, dietary modification is very important. Healthy eating is very important. So it should be a part of your health education. Next is physical activities. So when you have physical activities, like if you are overweight, when you go to the gym, when you do exercise, you can be physically fit. So physical activities that is for the overweight is actually, they are not advisable to have high impact exercises. So it could damage also their knees, their joints, if they they will engage in high impact. So they would rather start with walking. Daily walking is very important. So like you really need to have at least 10,000 steps every day, every single day. And then increase it little by little into brisk walking. When we say brisk walking, you walk, but it is in a faster pace. So you really have to do brisk walking. That is to have a good circulation. Remember that if you have a lot of fat, it can block the blood vessels, right? So, and then if you reduce your weight, you can start high impact jogging and others. Or the easiest way to reduce weight is actually to go to gym, and then you will be guided on how to develop muscles, and these muscles can actually be used in burning fat in your body. So physical activities for an overweight and dietary modification is very important. Next slide, please. Okay, so for those who are less active individuals, who are like, they are not really into physical activities, or maybe they go into physical like walking, but 3 times in a day, or 3 times in a week. So what is the advice for this one is to go into physical activities. As I have said, brisk walking is important. Low impact exercises, they can have yoga. Swimming is also a good body and mind exercises. So it can help in the reduction of not only the weight, but also it can also help in de-stressing, because your mind and body really relax during swimming. So some advice for this one, as I have said, go to, if you have time and you have money, you can go to the gym. Next. Okay, so for some problems like fatty liver, as I have said earlier, that problem in the liver can develop into hyperglycemia, and it is a risk factor for pre-diabetes, and later it could result to type 2 diabetes mellitus. So what is the good advice? Of course, health education is important for non-alcoholic fatty liver. So what is included in your health education when you talk to someone or care someone who is having fatty liver that is non-alcoholic? Meaning to say the person is not into alcohol, but she or he is diagnosed to have fatty liver. So number 1, the best is to have lifestyle changes. So we know that sometimes we are not having this kind of lifestyle that is healthy lifestyle. So like we are eating a lot, we are sedentary, meaning to say you are not moving, you are not ambulating, you are just sitting for the whole day. Maybe maybe you are just facing your gadget, right? You are just facing your gadget. So that could make you sedentary. And with that being sedentary, you don't have a good blood circulation. So, and then if you keep on eating while you are sedentary, it will result again to overweight problem. So, lifestyle changes is important. So what are the things that you should input or give in your health education for the lifestyle changes? If she is sedentary, she can be advised to do some physical fitness program. If she is eating a lot of non-healthy food, she can be taught on how to change the eating habit. Okay? Yan. Next is, of course, if they are given an advice, if they are given an advice, they should follow. Because there are some people who go to the hospital, say, or to the outpatient department, but the problem is they don't follow the advice of the doctor. So if they're given medications for like, if they're given an advice like to take medication, they have to take it religiously. Like in some cases, if because one of the management of type 2 diabetes mellitus is actually oral hypoglycemic agent. So these are medication, and it could help in the reduction of blood sugar. So some people, they don't really take the medication seriously. So as a result, it is not so effective. So it could be a part of your health education. So lifestyle changes is very important for those who are not having a good or a healthy lifestyle. Next slide, please. Okay. So the one that I have mentioned earlier about non-modifiable risk factors, like the age that is more than 45, hereditary, history of gestational diabetes or history of delivery of 9 pounds baby, if they have that in their race, if they belong to the Latino, American, Indian, American. So the thing is, they have that in their family. So the best thing to do for these clients are health education. So for the health education, you already have to prevent, because there are some instances that this type 2 diabetes mellitus can be prevented. It will depend on even if you have that in your genes. Because I knew I knew a friend who is having a hereditary of diabetes mellitus actually. His two brothers are diagnosed to have that. The youngest is not yet diagnosed, and he is the third brother. And he said he's not suffering from that kind of disease. So meaning to say, the diabetes mellitus runs in the family, but he is really very conscious when it comes to diet. He eats less rice, less carbohydrates, and then he really don't eat those carbohydrates high food. So as of now, he is like 56 years old, but he has no problem with the blood sugar. But two of his brothers are actually suffering from the disease. So meaning to say, that is hereditary, but it could be there could be a possibility that one of the siblings will not suffer from the hereditary disease. So it has something to do with the lifestyle actually. So he is 56, so that is more than 45. And they have that in their genes. Although in the race, that is not mentioned because he is a Mexican. So in race, he is safe in terms of race, but the age, the heredity, he is a candidate for a diabetes mellitus. But as at the age of 56, he has he's not diagnosed to have a diabetes mellitus like his brothers. So it's just a matter of lifestyle. It's just a matter of eating healthy. And he walks a lot, actually. He walks a lot because that is the nature of his job. So it is a good point. So that is for non-modifiable risk. My point is you will be able to avoid having the development of diabetes mellitus, but it has something to do with the lifestyle, with the diet. Okay? So history of gestational diabetes, you really cannot do anything otherwise but to have a lifestyle changes. Healthy diet, good exercise, be fit, those are the things that they can do. You can teach them to prevent developing type 2 diabetes mellitus. Next slide, please. Okay. So for the risk factors of gestational diabetes mellitus, you know the risk factors, the management for this one, it is the same with pre-diabetes. And then I supposed to discuss about the PCOS, but then again, it is a part of my discussion for my student because my topic is actually more on maternal and child nursing. It's because of my educational attainment. I am a nurse and a midwife as well. That's the reason why I was able to input the gestational diabetes in here. It is not focused on the general, but I have included the gestational diabetes because it is a part of my lecture actually. But when it comes to PCOS, I will not be able to discuss it this time. Maybe it's another session that we can have because it is not really that will not be able to have that. And besides, I did not prepare for my slides on this one. So with the gestational diabetes, you can have the same management when it comes to giving nursing intervention or taking care of them. Next slide, please. Ayan, so that is for the PCOS. It's, as I have said, it's another session that maybe we can talk about. Next slide. Okay, so in the Philippines, because Sir Agus asked me if they really, maybe they can have a framework that is based from the Philippines and you can maybe have it in your country. So actually, the Philippine government role in the management of diabetes mellitus is they have the free here in the Philippines we have the free diabetes risk screening. That is very important. So the screening of the Filipino people, it is being free. So actually you can just go to the RHU and then you can be tested if you have high blood sugar. So free diabetes risk screening at the barangay health stations is a program of the DOH. In the health station, in the rural health units or health centers, in public hospitals, not of course in private because it's not free in the private hospital. So you really have to go to the public hospital to be screened if you are having risk for type 2 diabetes mellitus and other government health facilities. So also, because in the Philippine government, the one that is handling the program about health is the Department of Health or the so-called DOH. So the DOH also, they are giving medicines like oral hypoglycemic agent. It is free actually. Even the medication for hypertension, now they are giving it for free in the RH rural health unit. So There is free medications such as oral anti-diabetes or oral hypoglycemic agents in the RHU or rural health unit, and even insulin. It is given it is a part of the program of the Philippine government through the Department of Health. So the implementers of the Department Health programs are the municipal health units or the rural health unit. Okay, so insulin, it is given, and oral hypoglycemic agents, it is given for free. But sometimes we really cannot avoid that. Sometimes the difficulty of purchasing because of there are some factors that sometimes it's not available. Or even if it is programmed, sometimes there are lack of budget on this one. But at least they are helping the people by making the screening free, and some can avail the free medication for diabetes mellitus. Next slide, please. So in its commitment, the commitment of the government to the health of the people, so the DOH has also created partnership with the Philippine Society of Endocrinology, Diabetes, and Metabolism. It is a group of healthcare practitioners to help other people. Their function is actually they can give seminars, trainings. These are a group of professionals who knows about, like doctors who knows about diabetes. So there are groups who are helping people to give awareness program like seminars and trainings. So that is for free. So it is given, sometimes their programs are given for free in the government hospitals. So this, the Department of Health is having partnership or collaborating with the PESIDEM or the Philippine Society of Endocrinology, Diabetes, and Metabolism. This is to empower and build capacity among our primary healthcare workers in managing diabetes mellitus. That's the reason why, as I have said, that the government is doing something for the people, for the Filipino people. So they really want us. Actually, it is the goal of the vision of the Department of Health to have this health in the hands of the people. Meaning to say, the people will be responsible for their own health. So, in order, the role of the government is to capacitate or to build the capacity, or they are making capacity building through trainings, through health education, creating programs that could enhance the health or can help or to address the problem on health of the community people. So the PCDEM and the DOH are working towards in order to build capacity of the healthcare practitioners through training and workshops or seminars. So an estimate of more than 1,700 healthcare providers across the country were already trained. So this is done by the government in collaboration with the private or some organization. So that's it. Next slide. Another one. So the DOH and its key partners from different sectors, because we have actually, the Philippine government has private-public partnership, the so-called PPP, and it was actually created by the former President Aquino to have partnership between, because before the organizations, they have the so-called public sector and private sector. So it could not be, they are not helping each other. But when President Aquino actually became a president, so they have created this partnership between the public organization, public institution, or government institution, and the private sector. So that is the so-called PPP. So they became partners and they are committed to change the landscape of diabetes. So that is one of the efforts to address the problem in diabetes mellitus. So it's not only in the diabetes mellitus, even in the academe, there is a partner, public, PPP, the private and public partnership. So the Philippine government is doing that in order to address a lot of health issues, a lot of problem that can occur, and it could affect the Filipino people. So this is in response and to health issues on diabetes, and then that is to ensure better quality of life for all the Philippines. It is actually the program of the government through the Department of Health, or DOH. Next, please. Okay. The government and the DOH has already the so-called World Diabetes Day, WDD. It is an annual global event, not only here, but it is already adopted in the Philippines. So this is in response for the diabetes. This is an annual global event for driving awareness on diabetes and its risk factors. So this is officially observed also in the Philippines. So actually, all of the United Nations, we are actually following the World Health Organization's program, and then it is being adopted per nation, per country. So the Philippines is actually basing or making the WHO programs as a pattern in creating our own programs on health in the Philippines. So this WDD become an official, and it is observed annually through a proclamation. So it became it's like a law. So through a proclamation number 1942 series of 2009. So it has been declared that in November 14 to be like World Diabetes Day celebration. And so it is being celebrated actually. It's like HIV Day. It is like Women's Month that we are doing that. So there is a day for this one. And then some of the organizations that are related on this, like the DOH, they have that program in their own institutions. Like in our city, they have health education. They are posting banners so that all the programs can be disseminated well, and some people become aware of the programs of this. So this is the response of the government of the Philippines on this problem. Next. Okay. So the one that I have discussed earlier, it's not really the management of the Philippine government. So the Philippine government has this one, these programs, specific programs to prevent diabetes with healthy lifestyle. So what are these? One is achieving healthy weight. So it is also a pattern from the management of diabetes mellitus. So achieve healthy weight. So there are some instances that they are having programs like they are doing like Zumba. They are leading in some exercises like Zumba, and they have banners as well. They are helping the people actually doing healthy lifestyle to reduce weight. Another one, eat healthy. So it is still a pattern, but so it is adapted from the book. So eating healthy, that is through health education. Next is, to prevent diabetes, there must be a healthy lifestyle. So if you have a healthy lifestyle, you will be doing physically something to become, so you can be active in order to become physically fit. And another one is, we are implementing this one, actually, the non-smoking. So it is actually the government of the Philippines is very strict on this one. So no smoking in public places. So for those who are not smoking, they cannot inhale something. They cannot inhale the nicotine from the first-hand smoker. So there are posts, sign not to smoke in public places. And there are some so strict that they have this ordinance actually. And then with this ordinance, they can ask for a fine from the one who will be caught smoking in public, like in the park. So the government is so strict on this one. And another one, of course, the monitoring of blood glucose. It is a part, as I have said, it is a part as a screening program for diabetes mellitus of the Philippine government. So you can just go to the RHU or Rural Health Unit in order to have your blood monitored. Another one is, of course, follow the medical advice. So it is this picture is taken from the NNC government regional office in Luzon National Capital Region. So it is a part of the program of the government. Next slide, please. Okay, now let's go to the role of the nurse. With all the things that I have discussed, you know your role. You have an idea what to do in order to become a part of the program of the government in making the people healthy to avoid having type 2 diabetes mellitus. So with the screening for diabetes and educating the people on its signs and symptoms, ways to prevent and avoid complications play a great role in addressing this debilitating disease. Actually, yes, it is a debilitating disease because if you will have a problem in the eye, you can have diabetic retinopathy, you will become blind, you will not be able to work. There are some people here who have been discharged from their post as a government worker or a private worker, a worker in a private sector. They have been removed from their work. So it could cause disability. So it is termed as debilitating disease. If you will become if you have diabetic foot, your leg can be amputated and it can result to disability as well. So as a nurse, our role for the screening and our role in the Philippines as healthcare practitioner or those who are working in the rural health units and barangay stations or in the hospital is to assist the government in the implementation of the program of the government that is through the Department of Health. So what we can do as a nurse is to assist in the screening. You can volunteer, you can do health screening, monitoring of blood sugar, and the best that we can do is to disseminate information. How can we disseminate information? Through health education, because we are best in this one. we supposed to be doing health education to our client. Every time that we meet a client, we supposed to do it. So those are the things that we can do as a nurse in order to help the government in their program. Next slide, please. Okay, so I think that ends about the different topics that I have discussed this time. Yeah, it's almost, I think it's, we still have 18 minutes to discuss about your question.
Okay. Thank you for Madam Michelle A. Calda-Tolibas, Ph.D., MANR, for the material. The first material takes the title, The Latest Diabetes Mellitus Theory. The conclusion of the material is diabetes mellitus is a chronic disease caused by an imbalance in blood sugar levels. And in the second material, entitled The Assessment for Risk Factors of Diabetes Mellitus in Healthy People and the Role of Nurse in Overcoming for Risk Factors of Diabetes Mellitus, it can be concluded that management of NIDDM is health education, dietary modification, physical activities, and lifestyle change. And then for the risk factors, there is modifiable and non-modifiable factor. For non-modifiable, there is age, hereditary, history of gestational diabetes or history of delivery of 9 lbs baby, race, and for modifiable risk factors, there is overweight, over 45 years old, physically active less than 3 times a week, and if you have non-alcoholic fatty liver disease, you may also be at risk for type 2 diabetes. Okay, next we will open a question and answer session. The provisions that must be considered are as follows. Participants who want to ask question are welcome to state their identity first. Questions are asked briefly, concisely, and clearly. All right, let's just start this discussion session. I invite the audience to ask. There is have 1, 2, 3, 4, 5 questions in the chat column. I'll read it for Madam Michelle. The first question is from Klono Sewandono. In the Philippines, are there more type 2 or type 1 diabetes mellitus patients? And how do you screen diabetes mellitus sufferers there? Thank you.
So as I have said earlier, the part of the screening of diabetes mellitus is in the Philippines we have the program to have monitoring of blood sugar, checking the risk factors, doing health assessment of the client. So when you do your health assessment, you will be doing an interview with the client, and with that you'll be able to know about the different the history of the client, the one that I have mentioned earlier, like knowing the past medical history, the family history, because the hereditary disease will come out through an interview. So in physical education, you can, physical examination, you can check the physical appearance. So the overweight part of that interview of the client is, or health assessment is weighing the client. So with that, you'll be able to know that the person is overweight, and that is a risk factor for pre-diabetes. So with that, you'll be able to screen those. And then if you have a suspicion that this woman is, or this person is having this risk for or pre-diabetes signs and symptoms, they can be tested through screening of the blood for blood sugar. And they can be sent also, they can be given a laboratory request to go to the, because sometimes it is not available in the RHO. So they are advised to go to the hospital for some additional laboratory examination. So it is a part of the screening. Health assessment, laboratory studies, and physical examination is a part of the screening program.
Okay, thank you. Next, the next question is from Kasan Besari. Why being overweight or obese puts someone at risk of developing type 2 diabetes, and how common side type 2 diabetes are in obese people?
Okay, it has something to do with the conversion of the fat. So if you have fat in the body, so it can, there are a lot of there is a theory on this one that um um it can attribute to the production of hyperglycemia. Okay, if you have this accumulation of there is a research on that says that there is an overproduction theory of diabetes. So overproduction theory is one theory in developing diabetes, to which in its simplest terms, it attributes the glycosuria and hyperglycemia of diabetes not to a defect on oxidation of carbohydrates, but rather to an overproduction of glucose from protein and fat. That's the relationship between fatty people to the hyperglycemia because of an overproduction of dextrose from protein and fat, which causes its accumulation in spite of a continued ability to oxidize it. So that is actually the reason why the relationship between hyperglycemia and obese people.
Okay, thank you. For the next question from Plano Sewandan again. In gestational diabetes, will the baby also have a risk developing diabetes mellitus?
Yes. It is actually in hereditary in that, as I have said earlier, that if you have that in the genes, if your mother has a diabetes mellitus, or even your sister, your sibling, a female sibling, if she has this gestational history of gestational diabetes mellitus, you can have a sister, you can also have that because it is already in the gene. So when it comes to pregnancy, whatever is the genes of your mother or your father, there is a possibility. It's not a 100% sure that you really can have, but there is the risk for you to have this kind of disease because it is a hereditary disease actually.
Okay, thank you. For the next question from Klono Sewandono. What intervention are being relied in the Philippines for treating type 2 diabetes mellitus?
What? Can you repeat the question, ma'am?
Okay. What intervention are being relied in the Philippines for treating type 2 diabetes mellitus?
Actually, when it comes to management, it is more on oral hypoglycemic agent first. They are not actually treated right with the insulin. They are not managed right away with the insulin. When it comes to type 2 diabetes mellitus, it is more on oral hypoglycemic medication, dietary modification, and exercise. But for medical management, it is more on medication. So they give oral, more on oral. Unless it is a type 1 diabetes mellitus that they have to be given insulin. But for as a nurse, nursing management is different from medical management. So nursing management is more on we advise the person to go lifestyle changes, and the most is dietary modification as well as physical exercise.
Okay, thank you. Next question is from Kono Sewandono. Is there a separate therapy for type 2 diabetes mellitus patient that has proven effective in Philippines?
In the Philippines, actually, it is more of more on oral hypoglycemic, and there is no such thing as a new, but there are some community people that you are using also some herbs, but in medical practice it is more on medication. Sometimes they are just doing home remedies, or they are just treating or managing themselves at home using some of the people here resort to herbs. They can hear something that it is for like it can reduce blood sugar. Like actually some people are taking supplements like the bitter gourd, the ampalaya. So there are a lot of supplements that they said it can reduce blood sugar. However, most of the time, the management from the doctor is more on medication, the tablets, the synthetic. It's not the herbs form.
Okay, thank you. The last question is from Suramanggolo. Is there a therapy for diabetes mellitus patient in Philippines can be applied in Indonesia? Do you think the therapy from Philippines can be applied in Indonesia, madam?
Yeah, I think we have the same, like if you really want to go into traditional therapy, maybe I think it is you can plant your, because I think it is more on they research already on the ampalaya something, ampalaya tablets. They're having that one as, but although it is not really given by the medical doctors, but there are some who are practicing traditional, like, so they're taking the ampalaya. I think we have the same climate, and then you can plant ampalaya and you can apply it there. You can do it, and maybe it could be if you it's not yet a practice in your place, maybe you can do some research on this one, like maybe you can do an experiment, because ampalaya is still safe, and we can even eat that one. So maybe it could be a part of your research. You can do an experiment on this one if it is really effective, because there are so many people who believe in the ampalaya tablet here. So we have the same climate, so you can plant and you can do some research on this one. Who knows? You can develop as well, right?
Yeah, hopefully we can apply the Ampalaya tablet in Indonesian, or we can do some research
Yeah,
for
research
Ampalaya.
on, yeah,
Yes.
herbs,
But I mean,
maybe
I think
herbal plant.
Ampalaya is uh not grow in Indonesian.
Oh, I
I think, but I don't know
because
because the
I
weather.
think in Asia we have, I think, the same weather. We have the same climate, so maybe you can have that.
Oh yeah,
Maybe
maybe.
that's one thing that you can have also in how to grow ampalaya first. that may be the phase 1 of your study, and then the second one is to experiment if it is really effective in reduction of the blood sugar, right? So it could be maybe you can have that one as your research, right?
Yeah, okay, I'll
Yeah.
try. I'll try. The Ampalaya tablet, okay. Okay, everyone.
Excuse me, I have one question for Madam. Excuse
Okay.
me, moderators.
Yeah. Yes, sir.
No, sure. I just a
My
goose.
textmate.
I just a goose.
Yeah.
Hmm, thank you, Madam. I need for your suggest to us because we have a mission to prevent our people from type 2 diabetes. And what your suggest to us, the instrument that we can use to screen our people, so they can be prevented for early. That is
Okay. So it is actually on nursing. As a nurse, it is more on the screening that can be uh, used in all types of health issues. Is more on health assessment first. So health assessment is composed of comprehensive health history taking. So you will be able to gather some like information that is related to heredity, family, history, past medical history. So you will be able with that one. You will be able to check if he is suffering or she is suffering from uh, kind of disease that includes the type 2 diabetes mellitus. So on the medical part, it is more on blood sugar testing. So, but before they go into invasive procedure like extracting blood, of course, definitely it is more on the comprehensive health history. With that, if you know about the manifestations or signs and symptoms of pre-diabetes, risk in pre-diabetes or type 2 diabetes mellitus, you will be able to have an initial diagnosis that maybe this person is suffering or maybe he has already this pre-diabetes risk. So with that, you can have health assessment, a comprehensive health assessment and physical examination, because as I have said, one of the risks is overweight, increase in weight, and then so you will be able to assess and have an initial diagnosis on that one, and then refer the patient to the doctor for more invasive and comprehensive assessment, and that includes laboratory. So it's more on part of the nurse. It is more on health assessment. You'll be able to screen.
okay. Thank you, Madam.
Okay, you're welcome.
And excuse me, please fill your name and your role and your signature in attendance, please. That is I send to you the link of attendance
Where?
in WhatsApp.
Okay. Yeah, I have not checked yet.
Okay, thank you.
Okay. I will.
Okay, the discussion session is enough. Ladies and gentlemen, this is the guest lecture, this time with the theme, the assessment for risk factors of type 2 diabetes mellitus in health people and the role of nurses in overcoming it. We would like to say thanks again for the presenter, Madam Michelle, and all of the audience for participation. Hopefully, the presentation will be benefit for us. Thank you for your attention. Keep up the spirit and see you. Then I return to MC. Thank you for Madam Michelle. Hopefully we can meet for another
Yeah.
time.
Yeah, I hope so.
Okay, thank you, Natalia, for guiding our discussion today. Well, that's all about the presentation and discussion with Madam Michelle Calda-Tolibas, Ph.D., MEN, RNRM, with the topic, the assessments for risk factors of type 2 diabetes mellitus in health people and the role of nurse in overcoming it. Thank you for the question and Madam Michelle for the great words to answer all of those. Our discussion today was very interesting and useful. We already know about many things about diabetes mellitus and what the role of the nurse is screening of for diabetes and educating people. Things will be going well for both Madam Michelle and the participants. Lecturers and all participants for joining our event today. And thank you so much for the attention. I'm Ricardo Widianingrum. At the MC, I would like to say sorry if there are any mistakes. Keep adhering to health protocols by wearing masks, washing your hands, keeping physical distance, and stay away from crowds. Good afternoon and see you next time. Wassalamualaikum warahmatullahi wabarakatuh. Thank you, Madam Michelle.
Waalaikumsalam warahmatullahi
Thank you, Madam.
Thank you, Madam. Good morning.
Good morning. We hope that
Nice.
program can be continued.
Yeah,
Madam.
I hope so.
Yes.
I also hope.
Thank you, Madam.
Okay, you're welcome.
Regrets, the best regret from us in here. Okay.
Need to take a picture, Pak Agus.
Okay, we can take a picture.
Okay, everybody, please light on your camera. We will take a picture. Okay, please. From the first page. Ready? Okay, 3, 2, 1. Okay, done. Then the next page.
Thank you.
Please on your camera and take your nice face. Okay, wait a moment. Okay, ready? We will take 3, 2, 1, and go. Okay, finish, Pak Agus.
Okay, thank you, Mr. Marsudi. Thank you, Mr. And you can leave to continue your activity, and then we need I hope can meet you face to face in Indonesia or in Philippines.
Yeah, I hope I can go there.
Same with me.
Yeah, I want to visit Indonesia.
Really?
I have a lot of classmates in Ph.D. that Dr. Wiwin is one.
Oh yes.
And we have from different universities as well. Yeah.
There is.
I hope I can go there.
Okay. I'm waiting for you.
Yeah.
Okay.
Thank you.
Good. Good morning, Madam.
Yeah. So is the program done already?
Yes, Madam. This program is done. Thank you very much.
Oh, okay. Thank you so much also.
Thank you. My pleasure.
Okay.
Pak Mar bisa di end meeting.
Okay, bagus. We will end this session centrally. Okay, thank you, everyone.